So if you're only missing one tooth, why a dental implant over a traditional bridge?
So bridges work. They have been there for years, but it's still a patchwork. You know, you replace one tooth by grinding down two adjacent teeth. So down the line, if you get decay, then it starts a snowball. You have to remove that bridge, make a longer bridge. So a single dental implant is just replace that tooth, and you don't have to mess with any of the teeth. There are 40 million people which have no teeth, and it all starts with one tooth. So get a single tooth implant, and in the short run, it may be a little bit more expensive, but in the long run, it's way less expensive.
Now, if somebody in your family, and they were of the age where they were candidates, if they were just missing one tooth, would you never do a bridge?
Absolutely not. I would not do a bridge ever on a person who's only missing a single tooth. I would always like to do implant on a patient who's missing a
So why don't they all do it? They're just afraid because they hear it's like surgery? Because it sounds very painful.
So that's one of the reasons why they don't want to get, because they think like someone's drilling a screw in their head, which is basically drilling a screw in the head, but it's just like getting a tooth removed. Because when we remove the tooth, or you're missing a tooth, the hole is almost already there. So what we do is we make the hole the size of the implant, and we put the implant in there, and then it just heals just like a normal tooth extraction would heal. And then we put a crown on it, and then you're done. So that's one of the reason, and the cost. But the cost should not be should not be a reason anymore to not to get a dental implant, because we also do financing.
Okay.
So they can also finance, even if it's a single tooth, we still offer financing. So cost should not be an issue. So those are the two main reasons why they don't get it. But it's a standard of care nowadays to replace a single tooth with a single dental implant instead of a bridge.